Well, good morning. This is Eric Rollins, the Constitutionalist, here on 1550 KXEX, the best talk in town. Also now on 102.3 FM. You can also find us on social media through Rumble, Truth Social, Facebook, Twitter. So we're a growing station. I look forward to my conversation today. We're going to deal with some of the fallout of all of the ridiculous rules, all the tyranny that came with COVID. I think that a lot of people saw it as an opportunity. I know that our governor saw it as an opportunity. He immediately said, well, this is an opportunity to have a more progressive type of capitalism. That was one of the first statements he made. Not, oh my God, people might die, this is serious, but we can have a more progressive type of capitalism. I don't want to focus on that, but I always want to point out that Governor Newsom, once he was put in full control, he got emergency powers. He decided to close down churches, but the casinos got to stay open. And the even bigger one is Newsom went, well, you can't go to church, but boy, if you need to go to a strip club, that's okay. That's the type of man that runs California. We're going to get a little more specific. I'm dealing or talking to a nurse this morning, and we're going to talk about kind of what's still going on with COVID. Maybe have some solutions. Hopefully, at the very least, get people more informed so they understand how they can navigate the system. Most of us are connected, like I'm connected to Kaiser, and I'm not happy, but I don't quite know where else to go. So I'm going to put up with it and navigate the system the best I can while not complying with some of the things that the doctors are telling me, because I profoundly think they're wrong. I don't have a doctor's degree, but I'm pretty good at reading a synopsis of a study, and I've read them from all around the world. And something's not right with COVID. What they're telling us isn't okay. What they're telling us about the mask, which finally got proved, though I would point out that there were studies from around the world beforehand that dealt with a very closely related virus of the same size that said masks don't work, and there was no proof. And yet they wanted to muzzle us. And I think it was that they wanted to muzzle us. I noticed that with a lot of my healthcare worker friends, they also wanted to muzzle them. So I'm going to stop rambling on. Welcome.
Thank you.
Your name?
Sherie.
Sherie. I wanted to pronounce it right. And you work with kids, newborn babies?
Yes.
Or little kids?
Newborn babies.
Newborn babies.
Yes.
Okay. So what are you seeing in the hospitals right now?
So I work with pregnant women having babies. So mainly with the laboring mom. I'm seeing patients a lot happier, being able to have their family in there in a very exciting time in their life.
So that's shifted. They're
yes.
no longer keeping everybody out.
Correct. And things changed frequently, and so that how many people you can have, family members you can have visit has changed and whatnot. So we're kind of getting back to the norm where pre-COVID. Also being able to labor without having a mask on has been a joy for them, or just knowing that like when the nurse comes in, they just put their mask up, and you just think, okay, when you're in labor, you're like in
Well, I
pain
don't
and
actually know.
huffing
I'm
and
gonna pretend like I know.
well, you've seen it in the
I've
movies,
seen it in the
I'm
movies.
sure. Yeah, so you're breathing through the contractions, and you've got this mask on, so they would automatically pull it up because they weren't sure how the nurse was going to feel about it. And so them not having to have that anxiousness I've seen a lot of ease in them, which has been great. This is that experience that we want them to have. We don't want them to have fear and anxiety during a time that's exciting.
But I think that's the key thing with masks. There might be a place where a medical professional could fit test that mask and use one of quality that it might actually prevent some things.
Absolutely. And that's why we do fit testing every year. The medical professionals have to do that. So when everyone was told they had to wear a mask no matter where they went, and they're not wearing them properly, but they're also not wearing just a mask. They're wearing a bandana
Mhm.
or, some cloth.
It was a waste of time.
It was, yeah. So we always just kind of looked at it going, okay, this is interesting. But a lot of people didn't even realize. So even if you had a mask that could be properly fitted, like an N95, if it's not properly tested, I mean, we go through. It takes a while it's like 15 minutes of 15 to 20, depending on if you got the right mask. If not, then you have to go kind of a litmus test.
Wait, so you don't just put your mask on in the store, take it off, use the same mask?
No. So no, we would change it. I mean, you have to. So if you have a situation where you're going in with someone who is contagious and is sick, you're going to wear the N95 that fits you, that
Right.
you've been fitted for. You would not wear that again after you left the room. You'd change it.
Well, I want to point out that you said that it creates anxiety for your pregnant patients.
Well, they weren't wearing the N95s. They
No,
were
but
wearing
just doesn't matter. It still creates
and
a barrier because you don't have the same communication. It's psychologically, it changes everything.
Absolutely. I mean, think about this. So when we used to see out in public anybody wearing a mask, it would be somebody who was looked like visibly they had been through chemotherapy or was elderly, and we maybe knew they were immunocompromised, and that would make you sad. Or you would and understand that would automatically go through your head. Or you would be in the hospital and you see someone wearing a mask because they were going into the OR. Those are the only times we would see someone with a mask. Those were always kind of sad things, and it could be scary, right, if you're in the hospital. So all of a sudden now everybody's wearing masks all the time. Never in my life did I think it would be okay to go into a bank and wear something covering your face, and then be told, I'm going to call the cops if you don't have this on your face. I mean, how nuts I was just bananas.
I went into my local bank. They said something, and I said, do you want my business? I went to a lot of places. Said, do you want my business? The only place I complied is until I found a grocery store because I had to have food. I didn't comply otherwise. I went into Lowe's. I went into Home Depot. They always said something. And I always said, do you want my business? I can leave.
Yeah, so that's where the division happened, right? Because you've got people who are being told by their employers they have to enforce this sort of mandate. What I was trying to educate people to, just in general, wherever I was the distinction between a mandate and a law. And there is quite the distinction.
There is a very big distinction.
Yeah.
And when somebody is using their emergency powers basically to play favorites, and that happened both at the federal level and at the state level, how does that protect everybody's liberties? We weren't all equal. Small businesses were largely shut down around the entire nation.
Oh, absolutely. Yeah, that's who was mostly affected. It was and making no money, and then the bigger businesses making a lot.
So, well, aside from masks, what other hospital protocols were they forcing you into? Was there a vaccine mandate?
Oh, absolutely. We know this in the medical field. There was a lot of us. I mean, the police department, the fire department. I mean, all these people that were supposed to be these frontline were now told, well, you're frontline. You need to take this.
But you'd already been exposed for months.
Well, not just that, but we're all waiting. I remember when we had this protocol for Ebola that had come out a couple of years prior to that. They were nothing like the drill for this, but they were acting like that. So they were gearing us all up like I felt like I was getting ready to go into a space shuttle. You'd kind of have to get everything up. Then when people were coming in, it was flu-like symptoms. And so, of course, every symptom could be COVID at this point. So, there's a reason to test all the time.
Well, there was an economic incentive for every symptom to be COVID, whether it was or not.
Right.
The government was paying, because of a bill that they passed, extra money if it got diagnosed as COVID. And I want to put as my proof that colds normally were 20 to 50,000 were reported that were serious enough to go to the hospital.
Right.
And they went to zero.
Yeah.
On the CDC website. Does anybody believe they actually went to zero? No, those got attributed to COVID.
Yeah. Well, on the hospital side too, we weren't seeing diagnosis that would typically be influenza A or B. It was all COVID. So it was eradicated all of a sudden. So, there were things all of a sudden the nurses were like, okay, red flags. We saw that. And every nurse knows this. It doesn't matter what department you were in, you were seeing that. So the mandates, yes, it was masks, mandates, social distancing, uh, just really difficult to do as a nurse. So these, all of it again was new. So everybody was everybody was like kind of walking on eggshells all the time. But that was also a really stressful time for the nurses.
Well, they were heroes. All of those people that had to deal with the public, and we really didn't know the first 3 months. That had to be kind of terrifying because the news only focused on the horror of COVID.
Well,
Nobody was really realized that, hey, this is only bad for people with comorbidities. It is not too bad for anybody else.
well, bad for comorbidities, but also bad if you're going to your doctor when you normally would have pre-COVID and you were feeling unwell, and maybe you would have gotten a Z-Pak or an antibiotic, and now you're being told go home and isolate, with no treatment. So you're just going to home to let that fester, which is total negligence. And I saw it happening all the time. I couldn't believe it. And then doctors that were wanting to use different treatments because, as a physician, you're supposed to be able to treat independently and your patients independently because we don't all fit in one box.
A great example of that is I'm allergic to Advil.
Okay.
Okay, so that one I just can't use.
Right.
Well, there's all kinds of things that people might be allergic or it works well or doesn't work well, even if they're closely related.
And
it's just not simple.
Even if you're not allergic to Motrin or ibuprofen, if there could be comorbidities that you have that you would not want to take Motrin for because it can, cause bleeding. So there's other things that that you would not want to take it for too.
My point was that we got to a point where doctors were not allowed to use their experience and treat patients individually. That we got to a point where they decided that, well, we're getting paid a great bonus if we diagnose it with COVID. Then we get paid a great bonus by the companies if we use remdesivir. If we put them on, and if we put them on a ventilator,
right?
Each step paid more money. So rather than sanity ruling the day, insanity took over.
Yes, I would agree with that. I would agree that you're on this ship and you're waiting for the captain to, know exactly where to go. Don't go into the iceberg sort of example. But going, I don't know how to steer it all of a sudden. So all these people that we trusted and are supposed to be able to come together and cooperate, you're supposed to do that. Go to a board and talk. You're supposed to talk about these things. You're now being told you can't experiment. You can't try different things for symptoms that we've seen. Cold symptoms. These are all things that we've seen. And then people that had comorbidities again. So when we get to the mandates, you're now going to give everybody an experimental vaccine, is what they're calling it, which it hadn't even been proven to be a vaccine at that point.
Well, they had to redefine the word vaccine because...
Okay, yeah. Yeah, they're changing lots of words.
Well, it used to be, the thought was, if you got a vaccine, then you couldn't get it. You couldn't spread it.
Right. Well, what they would do is you get a vaccine. This is how this works. You get a vaccine, then you will get a titer. They'll do a blood test, and that's a titer. So they check your antibody level. Based off your antibody level, you would then get a booster. So when they all of a sudden started saying that boosters were the next thing after the first two shots or the first one that they were mandating, I was questioning that. I was like, we're just blindly giving boosters now? We're not checking antibodies? What's going on? So,
well, but that was more money. Again, there's a system that is set up that connects Big government. Big government then used social media to censor any dissenting opinion or any different idea. You've got these deep connections between the hospital systems, the boards that make decisions, the people that make or conduct the studies. They're all paying each other off, and the money seems to come through Pfizer. So yes, I'm saying that I think that Fauci probably should see a jail cell.
Not just that. I mean, big pharma, they own the media. They
Well, watch the nightly news. Who are the commercials by?
Exactly. Everything's funded by big pharma. So there's always that conflict. And then you've got people who want to ask questions and find out the real answers, and you're like, where do you go? It's really difficult to find that because they actually do censor people who've done studies that were peer reviewed, trying to publish. They would actually pull it if it went against the narrative. For instance, like you said in the beginning, masks don't work, especially if they're not properly fitted and you're not wearing the right one.
Right, and they're not of the right quality.
Exactly.
We've now reached a point where we moved through the early part of COVID and it was just masks, and then it went to what medicines. And they decided that, and I think this largely had to do with Trump derangement syndrome, because you can find studies from around the world where ivermectin and hydroxychloroquine at least had some positive benefits, but they've not really found negative benefits.
Correct. That's what my understanding is and what I've read.
Yeah. And because Trump was advocating for those, I've been censored multiple times on social media just publishing an article or posting an article that was, say, from a different country, from their equivalent of the CDC that said this. Hey, folks, you should read this.
So what I would say to that is very early on, because I listened to Senate hearings, and I remember when Peter McCullough had come in and was, talking and giving his information, and he was working with people around the world. Italy, I know he was working with them because they had been hit very hard in the beginning.
Well, they have a very old population with a lot of comorbidities, and then they isolated them.
Right.
Which depressed them and made them more stressed, which made them more vulnerable.
Absolutely. Yep. But he went to them and was collaborating, which is what doctors would do and medical professionals, to see what was working. What did you use? What did you use that worked? What didn't work? So he was working together with that. So they were coming up with sort of a protocol, algorithm, if you will, because everybody, of course, doesn't fit in the same box, of here's this symptom, here, this is what we would use initially. And it was working. And he was almost going, like, look, this is working, and thought it would be good news. It was not good news. This is censor him now. He brought up ivermectin being used in, I believe it's Africa. They do use ivermectin, I think, weekly. It's called like the Sunday pill, if I am recalling that correctly. They use it kind of like we do Tylenol, for a headache or whatnot. And they were seeing less cases. So there are studies out there.
They weren't just using it for Tylenol. It is also used, I believe, for malaria.
That's right. I was going to say that. And so hydroxychloroquine was used as well. So since they were already using it just naturally weekly, everyone or the population that was more at risk, they were seeing less cases of COVID and less death.
There's also a really interesting study out of India where the equivalent of a state, I forget what they call them, they have a parliamentary government, but the equivalent of one of our states, gave everybody ivermectin. And their COVID cases dropped to almost zero. But nobody was making any money because ivermectin is relatively cheap unless you live in a state like California where they've decided that it is something evil. I don't think it's evil. I want to encourage everybody to go to the CDC website, type in ivermectin and cancer.
Yeah, absolutely. Yep.
And then all the kinds of stuff will come up. And it seems to be just fine for cancer, where you're really immunocompromised. But it's not for COVID. Something's up.
Well, when you're told to you can't even prescribe it. I mean, doctors are being. I know one specific doctor right now who has been. His license is at risk. I think they're getting ready to take it away. He's got like a $30,000 fine, and this isn't for narcotics that he's prescribed because he's a general practitioner. This is because he gave he had prescribed hydroxychloroquine and ivermectin for some of his patients that he thought that it would be beneficial for, which, surprise, it was. So when he goes to the board, I said, when you go to the board, I would just ask, hey, so my patients are alive. What am I here for? I did my due diligence. I took a Hippocratic oath, right, to do no harm. I didn't do any harm except for go against you saying I can't use something and practice independently. That's why I went into medicine. So a lot of doctors are leaving because of that. California mainly.
We're going to go ahead and go to break. This is Eric Rollins, the Constitutionalist, here on 1550 KXEX, the best talk in town. For all my social media folks, if you have comments, don't hesitate to make comments. I answer almost all comments. I do have one crazy stalker, and I believe in her right to free speech, but there's no such thing as a productive conversation. Everybody else, I respond to. I appreciate the fact that you take the time to listen to this show. I'm happy to say that this show is absolutely growing the last 3 months. There's been a real shift, and we've moved to some freedom platforms in Truth Social and Rumble, and great response. So I want to say thank you to everybody. Please like, please share. Let's go ahead and come back. This is Eric Rollins, the Constitutionalist, here on 1550 KXEX, the best talk in town. And today I am talking to a local nurse sitting here in Fresno, California, and we're kind of talking about her experience and the craziness of what's going on still to this day with COVID. Welcome, Sherie.
Thank you. Thank you for having me.
There seems to be still a push to have everybody vaccinated, but the number of people I know personally that have had COVID now multiple times, I've had it twice. Wasn't too bad. I had it in February, only time in my life I've ever lost taste and smell. That's why I believed it was COVID. I didn't get an antibody test. Second time I got it, I did get an antibody test. And it was very mild. But I was looking at, almost 3 years later. So maybe my natural immunity had waned a little bit. The whole idea that natural immunity doesn't work is insane to me. Humanity survived for how long until we got to modern Western medicine, where the solution is always more medicine or surgery.
Right.
And I have a real problem with that.
I do too. Now, that is something I can't really wrap my head around because natural immunity has always been something we've checked for. As I was saying earlier, we
checked antibody
titers.
Okay, you call them titer.
It's a titer, yeah. So that antibody level of whatever it is, rubella, chickenpox, so varicella, those we always check those, and based off of your antibody level, we would give a booster. So it can wane over time, but we don't even know at this point how long. I don't know. I can just put that out there. I don't know how long the immunity it lasts for COVID.
Well, there's an interesting story that has to do with that. There was a woman that had the 1918 flu, which is a variant of COVID, an earlier version. And she got tested in the 90s, early 90s. So she was quite an old woman, and she still had a very robust antibody level. Now, obviously that wasn't my case because I had it a second time. But I've not been vaxxed. I have multiple friends that have been vaxxed with multiple boosters and seem to get it on a regular basis.
It seems to be that you're a little bit more risk for developing or being with being exposed coming down with COVID. Somehow it's affecting our immune system. It just is. And I would even think that getting it, it's affecting you in some level as well, even if you haven't had the vaccine or the. I feel like I'm affirming it if I say vaccine because it's not really a vaccine. The shot, jab, whatever.
Well, and now at least we could say the word vaccine because our First Amendment rights have been somewhat restored.
This is just also insane to me. Honestly, it really is.
Yeah. Well, it is definitely insane. What could people do to take care of their health? Well, there's been a lot of studies about what people were more vulnerable. For instance, if you don't get enough sunlight, you don't have enough vitamin D. Are there
Correct.
other things that maybe we could take our health into our own hands?
This should be a basic thing that we're telling people.
And I'm a Kaiser, and they never do.
Yeah, so medical providers should be telling, the general practitioners should be telling their patients. It really it's D deficiency. It's flu season. They call it flu season, but it's vitamin D deficiency because we don't have the sun. We're not in the sun as much. Everybody should be taking vitamin D during winter and fall when we don't have the sun, when we're not outside and active. That does affect your vulnerability to getting any kind of cold. That exercising a little bit. I mean, even getting out there walking. Mental health is, we always have to, people don't put that as a priority, and it really is a priority because if your mental health is declining, everything else really is just going to sort of follow that. Isolating is not a good idea. we need each other. So educating each other on those, that this is a medical provider's job to tell you what to do to prevent something. And if you're not doing that, or you're not giving the right medications to cure somebody with, like, for instance, hydroxychloroquine or ivermectin, which have been proven to work by the doctors that were willing to go against the system and now are getting all the backlash. We need to be able to tell our patients that, and we can't be afraid because they trust what we say. So exercising, making sure that you're eating well. They make it very difficult to eat very well. McDonald's is on every other corner. Starbucks, or sugar and processed foods. So that's just going to create high cholesterol. Strokes are up. Like, I don't even know the statistics. I just know that there's a stroke alert in the hospital that I'm in, at least one every time I'm there. But I've never seen that before. It was occasional. Now it's all the time.
Now, there's some argument that it's because we isolated and we stressed ourselves out, and it's not the COVID shot. I think it's a combo.
Yeah, no, we're being told you can't. Correlation doesn't equal causation.
I listened to somebody talk about a study from Johns Hopkins that just got released. Basically, 1 in 35 have myocardial symptoms. 1 in 35. And this was a study that did not look at passive patients. They picked out a bunch of people. They screened them for other heart issues. And then the part that was really surprising to me was, instead of passive, meaning they reported it and then now you jumped into the study, they went out and found their own people. 777 people, 1 in 35 had issues after the jab. And 20 of those people were women. Now, that's not something that's been reported. That was really interesting to me this morning.
Yeah. Well, what I'm seeing in the population that I take care of is high blood pressure. And this is supposed to be a healthy population. So I've never seen that before, where they're actually diagnosed with hypertension even before they became pregnant. So traditionally, we would see that's one of a pregnancy complication can be PIH, pregnancy-induced hypertension, preeclampsia. Now patients, almost a great deal of them. I can't give the statistic, but it used to be once in a while I would see it. Once in a while I would see gestational diabetes. Once in a while type 2. Obviously type 1 is there. Type 2 has on the upswing. Gestational diabetes is on the upswing. So I'm seeing that all together. Obviously obesity, and I will say that it's what it's called, or being told you can't say that, but it is because you don't want to offend somebody. Well, we need to be educating them because it can be harmful for them. We want them to eat well and do well. That's what our job is.
Well, it's hard on your joints. It's hard on your organs. It's hard on everything if you're overweight.
And that is what when you are obese, you have a higher chance of having comorbidities that are going to affect your health. And then, of course, you're going to be using pharmaceuticals, and you're going to be going to the doctor more, potentially having lots of different things. It's just more medically costly.
The number of people I know that are older that are taking multiple medications, not 1, 5, sometimes 10. I don't see how they balance all of those out.
I don't deal with that population. I mean, I know what you're talking about. I know that it's a burden financially because we pay a lot more in the U.S. for medical for our prescriptions than any other country.
Right.
So I'm not sure. I mean, I know that there are a lot of people that are on just a lot of medications these days. That's just pretty much what we all go to. We all turn to a pill as opposed to something that could be beneficial, like exercise, eating well. But again, trying to eat well is very difficult. They make it very difficult to eat well. Plus, we have busy lives. It makes it very difficult to. You have to plan ahead to get the right food and eat whole foods. So I mean, I've looked at all of that. If you step back a bit and look at everything, you think, where is the incentive to be healthy at all? I mean, there really isn't. No one's talking, like you just said, the doctors aren't saying, here, take vitamin D during the winter because you're not going to be getting the vitamin D from the sun like you normally would have. Why are you not mentioning that? Why aren't you mentioning some of the other things or supplements or potential foods that have these high levels of vitamins and minerals that we need for like salt that's ionized or has iodine in it. I was trying to find some the other day. My doctor, we were talking about the thyroid disease is rampant too. Everybody has hypothyroidism, is taking Synthroid. But what salt is out there right now is the Himalayan salt and the sea salt. That doesn't have iodine. And it's an essential,
but it does have a lot of other things that are good. But there should be a balance there.
Absolutely. So, but those are the most popular kind of right now, and you need to have that, to have a healthy, thyroid.
What other symptoms are you seeing besides the hypertension in your patients?
Hypertension, diabetes, and obesity.
That's a bad combo.
It is, especially if you're coming into a baby and your chances of bleeding you're already at risk for bleeding. So lots of hemorrhages. It's also associated together, high blood pressure, higher chance of bleeding.
So all three of those things are coming together.
Yes.
It's like a trifecta. You just don't know why.
Yes.
Though I would say that the giant hidden thing in the room is, are you allowed to ask whether they're vaccinated?
Well, I already would know.
You would already know.
I would already
know. It would
know.
be on their chart?
Correct. Okay. That's not important to me. It's not, it's not something like I'm looking at, to be honest with you. I am at the facility that I work, that is most of they're highly vaccinated. I mean, it's encouraged and still pushed, not mandated, but encouraged. So, yes, I would definitely say that throughout with the people that I work with, they would say that there is a correlation with being, having the jab and then having these side effects.
Well, I've read
complications.
many reports about how essentially women's cycles are affected by the jab, so that it would make sense that it would, if they then became pregnant, it would still be affecting. If it affects your sexual organs, it would affect your sexual organs.
Yeah, no, I've heard that too. I haven't really read the studies on that, and I've heard a few talks on that with OBs that are talking about it. We don't talk about it at work necessarily.
Wait, and that would be the place to talk about it.
Yeah. Well, we play the game of taboo at work. There's things you can and there's things you can't talk about. because you then sort of get put in this category of, oh, she's not going to like sort of fall in line, if that makes sense. I'm going to ask questions. I'm not going to ever stop because I am a patient advocate. That is my job. I will treat my patients the way I want to be treated. If I came into a hospital, I would want someone telling me the truth. Or if they had a question, if I had a question, I would want them to say, I don't know the answer, but let me help you find it. We'll figure it out together. That's how it used to work.
Mm-hmm.
I don't feel like it's that way anymore. So that's been a bit of a challenge for me because I love what I do. I'm just not loving what I'm seeing with how everybody's dealing with it. And, and I ask questions, with regards to, Hippocratic oaths. There's been physicians that have said things to patients with regards to statistics that they can't back up. So I've asked, where did you get that statistic? This patient had said that you told them this. Where did you get the information? Oh, well, I heard it. And I said, well, you can't just say that. That's
right.
I mean, and that's negligence, really, to say that, because it's essentially encouraging someone to do something based off of what maybe you heard. There's no study to back it up.
Well, California, the legislature passed, and I don't know if what finally happened with this bill. I don't know whether Newsom signed it, but it basically made doctors follow the government protocol, meaning the state, whatever the state had decided, you must comply. Like
It
a
did
communist
get
system.
passed, I believe, but then I think there was a stay on that. They
So it went to the courts.
correct. Yeah. So there was some backlash on that and arguing. I know in the beginning as well, there were doctors that were being flagged if they gave a medical exemption for more than 5 patients to not have to take the jab because they weren't sure. They were being independent thinkers and treating their patients as individuals and not fitting in all the same category. They were saying, you have these comorbidities. I'm not sure that this would work, or you have a heart condition. I don't know that I would want to put you in this experiment group. Because it was an experiment.
It is still an experiment.
Right. Well, especially in the beginning. I mean, at least we have some idea that it doesn't work. So the fact that they're even pushing it still is honestly, I'm just.
It's about money.
It baffles me a little bit. So.
Well, it should, but it's about money.
It's money, but it's also, I think it's control as well.
Oh, absolutely.
It's training us to be do as you're told and don't ask questions. And there's not a lot of people that are really liking that right now.
Well, I think that the culture is beginning to shift.
I do too.
In a lot of ways. I just saw a study, and we're getting off the medical topic, that particularly boys, but Gen X boys, are much more conservative than they've ever seen in modern times. Ever since they've been taking polls of it, and there's been polls of that for years. And during the Carter administration, teenage boys were more likely to call themselves liberal. Now, they're dramatically more likely, more than a 2-to-1, to call themselves conservatives or very conservative. Culture shifting.
Well, when they're not, obviously, that age group, they don't watch the news. I know when I was younger, when my parents put the news on, I'm like, oh, great, the news,
Oh, I was a nerd, so I did.
Yeah, no, I'm totally, my kids are like, oh, great, she's putting the news on. We have to listen to this? You want to keep up. And I don't listen to the news. I listen to more podcasts just because that's where I'm getting my information. So to segue back to what you were saying with that generation, I think that the podcasts, these young boys are listening to people like Andrew Tate.
Well, and Jordan Peterson, actually.
Absolutely. Oh, he was here in Fresno, actually, about a year ago. I was bummed. I'm like, I missed him. I think he's at the Save Mart Center. And I had a young guy who was in his mid-30s who had gone to see him, and a bunch of his buddies. Absolutely. Listening to what it's like to, to be a man, honestly. And I don't know what your feelings are about Andrew Tate. I have mixed feelings on him.
Same mixed.
Yeah.
But he consistently provides a strong male role model.
Yes. Yeah.
And that will attract young boys, even though he's not always wise.
No, absolutely. I agree with that. Yeah. I think because my boys listen to him, so I pay attention to what my kids are listening to. So that's why I brought him up. But what the take has been with my boys has been more of a just, it's been a positive thing. It hasn't been anything that has been the part that I'm like, whoa, I don't know about that, Andrew.
Well, good. We're going to go ahead and take our last break. This is Eric Rollins, the Constitutionalist, here on 1550 KXEX, the best talk in town, now also on 102.3 FM. So, last segment, we're going to come back in just a minute. I always like to focus on hope, solutions, potentially doctors that are resources, ways to find out more about how to move forward, how to protect your own health. Let's go ahead and come back. This is Eric Rollins, the Constitutionalist, here on 1550 KXEX, the best talk in town. And we're talking about how COVID tyranny kind of isn't over, that there's still some vestiges of it, because I think that once certain types of people get power, they don't want to let go. And then there's money involved too, which complicates it. And I am joined by a local nurse, Sherie. Welcome.
Thank you.
So as you know, I like to always focus on the more positive and solutions as going forward. So who do you use for resources?
Well, I look studies up. I'm pretty big on that, but I also am seeing things. So if we're talking about does the vaccine work, and you're reading a study, or what am I seeing? I'm seeing people that are getting COVID after they're being told to take this shot and get boosters and that kind of stuff. Looking information up, not just listening to the news. You want to do that. That's going to be very important. Finding somebody that you trust. If a doctor isn't going to answer your questions, maybe find a different one. It's very hard to find because the regulations in California are, as you had said, when they were trying to silence doctors and tell them what they couldn't do. We have to hold our medical providers accountable. It's all about accountability. So if they're not going to answer your questions, you need to move on to the next one that will.
So do you have some favorite? You mentioned Dr. Peter McCullough. Do you have other favorites?
Well, locally, David Palmer is he's a great doctor, and his practice open to discussing and saying what he sees, not pushing anything on anybody. And that's really what we do as a labor and delivery nurse. When I go in and talk to my patients, I tell them what their options are and the benefit and risk, and I let them make their choice. That's what
as if there was informed consent, which
yeah,
has almost
no,
been
I give
forgotten.
It. Yeah, no, I give it. I give informed consent. That's really imperative for me. I need to sleep at night.
I personally often listen to Dr. Jane Ruby.
Okay.
I think that she provides a lot of information, has good discussion. She brings other doctors that are specialists in some aspect of what's going on with COVID, and I think that it can be very useful. I don't know that she's always right, because I am not a medical professional, but I'm reasonably bright and I can follow information. And so I think there's a good resource. You can find her on Rumble.
I actually know a bunch of. You were asking me just a number. I just gave you a local only because it's hard to find. I actually got rid of my pediatrician because they were pushing this on my children, and that just wasn't going to happen. So just trying to find a provider that's going to respect you and your what you want in terms of your medical care, listening to what they have to say. But when you have a doctor that's always saying, I'm going to go by the CDC guidelines, I don't know. I mean, the CDC was kind of wrong on some of it. We're finding some new stuff out, but some of the information is actually on the CDC website that talks about masks not working, or ivermectin does work. So when you're being told that it's not, but we follow the CDC guidelines, well, then you need to go read them again, because you're telling me the opposite thing. You're saying you follow their guidelines. Their guidelines say opposite of what you're telling me. That's what they used to say. They updated it, so go back and read it.
Well, that is a good note that they've actually changed some of it.
Yes.
Also locally, a good pharmacist might matter. And
oh, absolutely.
Quantum RX.
Okay. Yeah,
it's
I know.
a good place to go. I happen to know some of the people there pretty well.
Great. Yeah, no, I know. We were all trying to find the right compounding pharmacy for to get.
I would recommend that one.
Okay. Yeah. No, no pharmacy I went to was like a few want this prescription of ivermectin filled. If it's for COVID, we won't fill it. I couldn't believe it. I'm still just like, everything's still a little shocking. It is.
So aside from places to research, and you said you like to go to study, so how do you find a study? Because if you go to Google, if it's a study they don't like, they bury it. I went to YouTube this last couple of days and was trying to research a few things, and it amazed me how, unless I put in almost exactly the right title, they buried it with the opposite perspective.
Well, if you go to Google first, that would be, I guess, the best place to go to find the studies you don't want to read.
Well, yeah, and I can find the ones I don't want to read,
Yeah.
because they always put those at the top.
Yeah.
They play this favorite game. It's a little better with DuckDuckGo.
Yeah, that's what I use usually. So going to so when I usually listen to podcasts, and I'll like the doctor you were just talking about, the podcaster that has doctors that come on to discuss things, I'll look them up. They always have references. The real Anthony Fauci actually has a ton of references on different studies that were put out there. Tom Renz, I think he's actually an attorney that was fighting against all of this with the hospital stuff tyranny. There was a ton of studies that were posted because he worked with a bunch of doctors. So I'm listening to people that are fighting, and then I look at their references. That's how I find it. I don't usually just Google and go,
Okay.
COVID plus treatment, if that makes sense.
But sometimes if this was a new category for me, so I started there.
Right.
And then
absolutely.
you've got to find some names and work from there.
Right.
Well, we were lucky enough to have Dr. Peter McCullough come to Fresno about 2.5 years ago, 2 years ago.
Yeah, I remember I actually got sick. I wasn't able to go.
I was there.
Tickets. How was that? I actually met the gal that had orchestrated all of that and had
Renee?
him come here. Renee.
Yeah.
Yes. Mama Bears.
Mama Bears.
Yep.
Renee's a friend.
Yeah. I love her. Just really great person.
I want to go ahead and mention an event, and I don't know if you're going to be there, and if you were, people could potentially talk to you in person. That is August 5th, this Saturday, at the Clovis Veterans Hall. You can, you're supposed to register, but you could buy tickets at the door. It is the Great American Freedom Revival. We will be featuring some great speakers. We've got our leader, who is going to speak on biblical prophecy. That is Ted Laurent. We've got Tim Barton, who's going to speak on history, and Wall Builders does a great job of connecting Christianity, the Constitution, and American history.
That's great.
And then we've got one other speaker that I'm excited about. He's at this station, or at least he's syndicated through this station. That would be Officer Tatum, Brandon Tatum. And he's going to speak about the present.
That's awesome. Well, I already have my ticket.
You told me that. So potentially somebody could meet and talk to you there.
Yeah, absolutely.
I hope I meet a bunch of people there.
Oh, I think we will. I think we'll meet a lot of great people.
So why are you hopeful? We're down to about a minute and a half.
Well, I mean, I'm a Christian. I love, the Lord, and that has actually got me through all of this. So I have hope always because of, my Lord and Savior, Jesus Christ. And I see people waking up and people wanting to help other people and being brave enough to come out and speak when they weren't before. So that's the hope. I'm seeing people come together and wake up.
So it's not a lone person standing up.
No.
Well, I think that to change this, there's going to have to be some mass peaceful non-compliance.
Absolutely.
Now, I'm not calling for a revolution. I'm hoping that through peaceful means and for getting out and voting, that we can make a difference and that we can get back to some of those first principles that this country was founded on, where we all have individual liberty, where at least the ideal was that we were all created equal and that we were granted those rights from God.
Absolutely.
Which I think is key.
It's fundamental.
It's absolutely fundamental. That is bedrock.
You have to have a strong, solid foundation built on the rock. And that is, if you have that with God, with any kind of a belief in the Lord, you cannot go wrong because you're walking with him.
Absolutely. Well, folks, You have another opportunity to go out, meet like-minded people, and get involved. This is Eric Rollins, the Constitutionalist, here on 1550 KXEX, the best talk in town. Any final thoughts for our social media audience?
Always ask questions. Ask questions. If you don't get your questions answered, find somewhere else that is going to satisfy it. Always ask questions.
Cool.
Very important.
Well, I thank you for this time.